Okay, welcome, Dr. Miaken Ziegler of Monarch Family Chiropractic. And tonight we are talking about understanding dizziness or vertigo. We're going to go into some anatomy and physiology today. We are going to talk about differences of vertigo or dizziness, or what is categorized under the umbrella of dizziness. I think some of you might be surprised. But first, I just want you to understand that over 70% of people will experience an episode of dizziness in their lifetime. And it's the second most common complaint heard at a doctor's office. Balance disorders are the number one complaint in people over the age of 70. So you might be wondering, why are we talking about balance? We'll get into that. So with that being said, shouldn't dizziness be easily treatable, right? Shouldn't providers be knowledgeable of this condition? And we are going to go into the details on how how Monarch Family Chiropractic approaches and addresses dizziness in our practice, and how chiropractic plays a huge role in that. So first, when we talk about your vestibular system, okay, add in stand here. You have to understand the anatomy and the physiology, okay? So the vestibular system is the sensory system that provides the brain with a sense of balance and spatial orientation for the purpose of coordinating movement with balance, okay? So you want to think about the sensors and the processors. What is being utilized to sense where our body is in space, and how is it processed inside our body, okay? So we have we have three main sensors and one processor. Let's go to my next slide. So first, you got the brain. The brain is the processor. And the sensor, so how the brain is receiving input from the body, is through our muscles and joints, through our inner ear, and then our visual system, which is our eyes. Okay, so I want to break down each of those systems. So first, muscles and joints. Each muscle and joint has a collection of sensory nerve fibers called proprioceptors, okay? These nerve fibers sense how much their muscle is contracted or what angle their joint is at, and then it sends the information to the brain. This is how your brain knows that where every body part is in space, okay? So we oftentimes call proprioception the sixth sense, but I don't need to see my arm or feel my arm to know that it is behind me right now. That is just the sixth sense of proprioception in how our brain is receiving sensory input from our muscles and joints to understand where our body is in space. Now, every joint has proprioceptors. So every joint is important. And the majority of proprioceptive input is at the ankle and the bottom of the feet and at your upper neck. So what does this sound like for you educated and informed chiropractic folk? It sounds like subluxation, right? Subluxation, a malalignment in the spine that puts stress upon a nervous system, altering the information received by the brain that alters output, okay? So when you think about the muscles and joints and how they feed good, healthy input into the brain, that is where chiropractic falls in terms of muscles and joints. Well, it also falls in other ways because we can massively influence the brain. So right now, everyone close your eyes, okay? Think about where your right arm is in space. Can you feel what angle your fingers, wrists, elbows, and shoulders are? Do you have a sense of where your head is in space? This is because your proprioceptive system for your muscles and joints are feeding your brain good information to understand where your body is in space, okay? This is going to be important to understand when it comes to dizziness. Okay, so next we have the inner ear. You guys can open your eyes so they're closed. Next you have the inner ear. So we're going through the sensors, so what the body is sensing to help the brain process where we are in space, okay? So your inner ear, or also called your vestibular apparatus, is to tell the brain where the body's head is in space. And it consists of two main sensors, the canals and the otoliths. Let's start with the canals. The canals are tube-like structures that are filled with like a honey-like fluid. So when your head turns, the fluid moves in the canals, which presses on a structure called the cupula. And then this signals the brain to tell the brain that the head is turning. Okay. Now there's three main canals. There's canals that allow for your head to go into rotation, your head to go into flexion and extension, and your head to drop right to left. So those three canals, as you're looking at this here, let me get my marker out. You've got, let's see, here's your posterior, your horizontal right here, and your anterior canal. Right? So you got to think about it in 3 dimensions, allowing for, as your head is moving, your brain is understanding where your head is in space. Okay? So you can shake your head no, you can shake your head yes, you do a little boogie, you can do dancing, right? And it's no problem. Your brain knows where we are in space. Now, then you have the otoliths. And these are like a block of jelly with little pebbles on top. Okay? This tells your brain when you're moving straight forward, like in a vehicle, or up and down, like an elevator. Okay? So there's a lot of motions and movements that your inner ear is providing to your brain to process where you are in space. Okay? Next, the eyes, your visual system. The eyes play a few roles when it comes to your vestibular system. Okay. First role is the eyes help the brain understand the sensory information that it's receiving so that it makes sense. Okay. Say the proprioceptors are telling the brain that your arm is next to your side. The brain will confirm that information by simply moving your eyes to it. Yep, there it is. Right. So it helps your eyes are helping support your brain understanding that sensory input. Okay. Now the eyes in the inner ear, I'm going to read this. I want to make sure I get this right. The eyes in the inner ear have some overlap when it comes to function of the vestibular system. When your head rotates to one side, you have a reflex called your vestibulo-ocular reflex, causing the eyes to move in an equal and opposite amount. Okay. So you can try it right now. Let's do it. So you put your thumb out at an arm's length in front of your eyes. Now slowly turn your head to the right. There you go. What happens to your eyes? Keep your eyes on the thumb, right? Now turn your head to the left. What happens to your eyes? Right? They are moving as your head is moving, but they're moving the opposite direction. Right? So if you didn't have this system, as you turned your head, your eyes would always go with where your head is. Right? So this system is allowing for your eyes to track something as your head is moving. Really important. Okay. So think about it as your eyes are the suspension system that keeps, they're the suspension systems for your brain. So it's like the car suspension system, keeping the rider comfortable and level. So it's constantly stabilizing those eyes. Okay. Am I moving too quick here? We're good?
We're tracking you.
You're tracking? You're tracking me? I'm tracking you. Right. So when it comes to dizziness, there's something going on with one of the 3 sensors or the processor, the brain, right? So it's either the muscles and joints, it's the inner ear, it's the eyes, or it's the brain. Okay. There you go. This will bring out dizziness. Also can be called vertigo. We're actually going to go into all the categories of defining dizziness. So there are 5 different categories of dizziness. First is vertigo. Vertigo is a sensation that the world or the person is spinning in circles. Doesn't sound very pleasant, huh? Imbalance, a sensation that the person may fall or is simply unstable on their feet. Raftiness or tilting, the sensation that the person is rocking. They're standing still, but they feel like they're rocking. If you've ever been on a cruise, right? You step off that ship, you feel like, oh, I feel like I'm still moving. right? That is under the category of dizziness. Motion sickness, the feeling of nausea combined with lightheadedness or raftiness. And lightheadedness, the sensation that the person may pass out. They may feel a disconnect between their conscious awareness and their physical body. Okay. So now that we understand that there's different categories of dizziness, and we also understand the sensors and processor of balance and spatial awareness that can allow us to do a deep dive into each category. Okay. So vertigo, the sensation that the world or the person is spinning in circles. This is indicative that there are faulty signals from the inner ear. Okay, remember that inner ear, the part of the vestibular system that allows us to go into rotation, lateral bending, flexion, extension, no problem. So if the canals are impacted, or the nerve that connects the brain to the end organ is impacted, either at the brainstem or the brainstem to the brain, then that could certainly cause vertigo. Now, the faulty signals, most commonly it is structural in nature, but it can be inflammatory. So there can be an infection component to this. A lot of times it's structural. In small percentages, 1 to 3%, it's vascular or it's a stroke. Okay. But the most common is what's called structural benign, it's structural, and it is benign paroxysmal positional vertigo, BPPV. And that is if you've ever heard somebody say, I got crystals in the ear. This is BPPV, and it is structural in nature. And a lot of times there is a maneuver that can be done called Epley's maneuver. There's others that can be Dr. Chris and I have both done it in the office, where you're bringing the head back and you're rotating and you're holding, and you bring it to neutral and you rotate it and you're holding. And it's really to reset what's happening in the inner ear, to reset those canals. In addition to what chiropractic is doing is assessing what's the alignment of your spine that directly influences nervous system input, but also muscle and joint positioning, right? So majority of the time when somebody has vertigo, it is structural, and it's from the inner ear, but also can be coming from the nerves that are going to the inner ear. Make sense? So it's nervous system. Okay. Just make sure everybody is, there we go. Okay, moving on here. What's next? Okay, lightheadedness. So the sensation that the person may pass out. They feel a disconnect between their conscious awareness and their physical body. So where is this coming from? Sometimes it can be coming from a blood-related disorder like anemia. The brain isn't getting the appropriate nutrients it needs. And so therefore, the processor is not able to function. And they may experience lightheadedness as a result. Okay, so it's literally lightheadedness is the brain not getting appropriate supply, blood supply or the nutrition that it needs. It also can come from dysautonomia, which is dysregulation of your nervous system. The brain is regulating your cardiovascular system. So it's in charge of constricting and dilating your blood vessels to make sure blood gets to the appropriate areas, right? As we pump blood, you got constriction and dilation happening. So if there is a poor signaling between the brain and the cardiovascular system where your cardiovascular system is confused on where the blood needs to go, it's causing dysregulation. Does that make sense? So then you can have lightheadedness, and you feel a disconnect between your conscious awareness and your physical body. Okay. Again, this is where the brain comes into play. This is where chiropractic comes into play, because we help regulate your nervous system. We give good, healthy input to start changing the output. Make sense? Okay. Next is imbalance, the sensation that a person may fall or is simply unstable on their feet. Okay. Imbalance can be a result of weak muscles, or it can be neurovestibular in nature. Now, one thing I love to share, this was at the time, one of my oldest patients in practice. She was about 92. And she had as I think most of us know, that as we age, we know that the more stable we are on our feet, the less likely we will fall, because oftentimes a broken hip or a hip fracture is really the starting of a cascading of events that occur to a downward spiral of mortality and disease, right? So in our minds, we're thinking, how can we keep our aging population, no matter how they're aging, but how can we keep our aging population in good balance, good motion movement on their feet? So I had this 92-year-old woman who came in, and oh my goodness, she was like maneuvering. She's very imbalanced on her feet. I'm sure you've seen a lot of these people before. Shuffling, didn't get very far. I mean, it took her time to get from point A to point B. 10 feet took her time. She had to be very careful on her feet. 10 adjustments. I didn't do anything. I just adjusted her spine. And I used to video people's gaits as they're walking down the hall. I used to video them back and forth. Literally, I had one video. I should find these. One video of her walking, when she first came in, 10 adjustments later, seeing her walk. Very smooth gait, very sure-footed, increased mile per hour, in terms of her ability to get from point A to point B. It was insane. I mean, I think we see awesome things happen all the time in practice, that sometimes we need to see the data in front of us, say, whoa, look at what happens when you get adjusted. It's so cool. I'm a chiropractic kid. I've been seeing and experiencing cool things all my life. It has become common and normal. But in no way is it common in our traditional healthcare system, right? It was so cool to see this 92-year-old woman, much more confident on her feet, walking, moving, that changed her life, right? So imbalance, it can be a challenge with your neurovestibular system, right? The vestibular system is visual input, your inner ears, your muscle joint system, and your brain. So a problem with the entire system. And then you can have an actual brain problem where you've got multiple sclerosis or Parkinson's, right? So there's actual challenge with the processor, which brain tissue is actually changed, okay? That can be contributing to imbalance. Next is, we're going over a lot of stuff, you guys. You guys with me still?
Yeah.
Yes, okay. So next we have raftiness, tilting, or rocking. Remember the sensation that a person is rocking. My kiddo got a swing. Oh my gosh, she loves to swing. I swang with her for probably 3 hours one day. I laid down. I was like, I still feel like I'm swinging right now, right? So that sensation. So this could be a result of the otoliths, okay? Remember the otoliths. Those are the canals. You got 3 of them that allow for rotation, bending, flexion, extension. So this is faulty signals from the inner ear, the ability to sense direct forward or backward motion, as well as straight up and down, right? So there's this one, and then if you're on an elevator or in your car, there's faulty signaling between that sensor and the brain. And or, could be both, proprioceptive, so faulty signals sent from the muscles and joints, we'll call it subluxation, between the muscle and joints and the brain, okay? If you have a history of neck or ankle injuries, because again, there's proprioceptive input from every joint in the body. Every joint's important, but the majority of your proprioceptive input is occurring at the ankles and the feet, and what's happening up here, upper cervical spine. So if you have a history of ankle injury or foot injury, you have a history of neck injury, this could cause some, you could fall into a dizziness category of rocking because you've got faulty signaling. Does that make sense?
Yeah.
And then we've got motion sickness, the feeling of nausea combined with lightheadedness. Lightheadedness is you're not getting the appropriate nutrition to the brain, or appropriate input, or raftiness, which is what we just went over, the feeling of rocking, tilting. So this is visual vestibular mismatch. What the inner ear and muscle joints are sensing doesn't match what the eyes are seeing. Okay. So it can be more complex in terms of, and again, you look at the complexity of being in an airplane or being in a car and you're moving forward and then you're moving your body, right? There's a lot of complexities. Or you're in an airplane, then you got elevation, change in, pressure. There's a lot of variables that your brain is processing to handle where you are in space right now. We don't think about it because our brain is so cool that it just handles it. It's just when it gets out of sync, we start to experience stress like this, right? So we look at how do we correct it? Number one, you've got to address the brain. You got to address the processor and the sensors, right? And that starts with a proper assessment. What we do here at Monarch Family Chiropractic is we do a detailed history. We do a detailed exam. That includes x-rays, assessing your posture and your structure. And I think the biggest thing is the processor is huge. So we want to make sure there's no stress on the processor. What's the processor?
The brain.
The brain. And what can cause impacts to the sensory input? Subluxation, yes. So every time you're getting adjusted, you're correcting those subluxations, which is proving brain input, right? Sometimes we have to go deeper and address what's happening in the inner ear by doing some structural positioning. Sometimes just the adjustment can correct it. Sometimes we need to look at eye exercises and give good visual stimulation to the visual center, your eyes. Sometimes you need to do all of those things. And that's why people do really well with chiropractic care when it comes to addressing dizziness. A lot of people don't know that though, right? And so that's where I'm going to end today, because I just went over a lot of stuff in a really, I said I was going to be prompt. I was going to get through it. And you may have questions, and that's okay. I'm happy to answer those questions. And I should say, we always say this, Dr. Brisson and I, the worst thing we can hear is, why didn't somebody tell me about this? What could have happened if I would have done this years ago? The what if? And so that's my challenge to you. Who do you know that needs to know this information? Who do you know that is dealing with dizziness that can't sit up without the room spinning, and they just got to deal with it? Or they're told, take what's the latest and greatest in medications, because we don't have a good healthcare system to address the structure, to address the brain and nervous system, to address the visual system, right? Or the inner ear system. People just don't know. And it's not your job to get them to sign on to anything, but it's your job to share it. That's all I'm asking. Just share what you know, because we got a big job here. We got an unhealthy community. Every age group is unhealthier now than they were 20, 30, 50 years ago in our country. By, the bigger population. We're all unhealthy, or not as healthy as we used to be. And that's not how it should be. So we gotta right the ship. We gotta right the ship here in Denver, Colorado. Amen. So that's my ask of you. Share what you know. Bring them to the adjustment, bring them to a workshop, share the workshop. Share during Appreciation Week. Don't wait till Appreciation Week. Some people don't want to deal with dizziness for another 4 months, right? So just share what you know. I love you. I appreciate you. Thank you for being here tonight, and bring your questions. The beauty is that you guys are getting adjusted. So you are addressing these systems, whether you know it or not. You're keeping your system nicely fine-tuned. So good job with that. Okay. All right, Dr. Miaken Ziegler, Monarch Family Chiropractic, and we'll see you when we see you.